as you just saw, we have a very fun, enterprising, and interesting personality on our podcast today. She was the head physio for the senior Karnataka women's team, assistant physio with Royal Challengers Bangalore women's, and is currently the head physio for the Gujarat Giants. And I think trophy winners. So great stuff. Thank you so much for coming on our podcast, Mridu.
Thanks, Harini. Thanks for having me. And yeah, we held the cup together.
Yes. Yay. So, Mridu, before we go into the slew of questions I have for you, can you give a quick intro about where you started, why, and how you're here?
Okay, so where I started. So, physiotherapy started like maybe in 2012. And it started because just wanted to do something different and I didn't want to get into engineering. I was a PCMB student. And through career counseling, I got to know about physiotherapy. That too, a dentist told me about this. And after my grad, because my brother used to play cricket, I got into masters in sports physiotherapy. Did not know down the lane I'm also getting gonna get into cricket, and which is pretty cool. And I also started developing interest in things like pole dancing. And as I see, there's not a niche of physiotherapists in India for pole dancers, and would like to explore a little bit more of that area as well because it's a completely different area. I'm also very interested in women health, did a pelvic floor training. So I'm a certified level 1 certified trainer in pelvic floor as well. So yeah, a lot of few things, interest here and there, brought him together where whatever I like, I started pursuing it, studying about it, and then physiotherapy is the one which has kept me engaged at the moment.
The way you say this whole journey, you make it sound so effortless. I mean, we know what goes into it to come to where you are right now. So hats off. And Paul, I was actually saving it for a little later. I do have something in mind for that. But let's start off with something little basic. Didn't you do a stint in football before you joined in cricket?
Yeah, so there's a place called Rapid Sports Fitness in Bangalore, which deals with a lot of footballers. And
Mhm.
I was with them for 9 months before I joined cricket. So they gave me a lot of opportunity to work with a lot of ISL players, and which was a really nice opportunity. Along with that, they had tennis players, skaters, and a lot of other sports. So yeah, I did do a small gig with them, but that was more on a clinical base. The interesting part was there were ISL physios. So we used to treat here and give them the report and then stay connected with the team. I know it was an external source, but the whole co-ed working together, being in a clinical in their city where the play athlete is, and then giving them a report so that they can program a structure for the player in the season. So off season and season. So I have done a bit of a work in off season for the footballers. So which was, yeah.
And if you had to draw a parallel between, I mean, we do have a similar structure in cricket. So if you have to draw a parallel between football and cricket, what would you say? Is it good, bad, areas of improvement?
Think each sport, like I mean, there is no good or bad here for that matter. I suppose both the profession are a bit different when it comes to the need they require. Especially football requires a bit more of it's a little bit more physically draining, and the injuries are much more severe there. So yeah, they require a lot more off-season training because to take care during their season. In cricket now, since there are a lot of tournament, there's no as such off season. But at least in now, the women cricket has also picked up so much. So initially we used to have a bit of like 3 months, 4 months of an off season, but now that doesn't exist. Absolutely, and CACO is doing like a really good job in order to keep them occupied, and there's no under training happening, and then they're loaded enough to take care. So I think that way everything has been well covered. But coming to infrastructure wise, I think football can do a little bit more better looking at the demand of the sport. Cricket has already gotten a lot of
Gone over and
attention
beyond.
from everyone. Yeah, yeah.
Yeah, wow. Okay, so fun question. Have you ever had a player come up to you with an injury? I won't even call it an injury, but say it's a bruise, and
Okay.
they build it up as if they've been shot.
Wow, Harini wasn't expecting this coming up here, but yeah, what can I expect otherwise? Okay, so this I've seen pretty common, but you'll find like in 20 athletes, there's just one player of that sort. So I recently had this incident where a 16-year-old girl
Mhm.
during a practice was going for a catch, had a displaced fracture here. It's
Mhm.
bleeding, it's cut, it's displaced, and there's not even a single tear. And she's just saying, ma'am, it's hurting. So you just have to make sure that, like, oh, it's really painful. That's all she'll say. It's hurting. We had to
Wow.
send her to the surgery. She underwent a surgery the very next day. She came back and she's like, ma'am, it's hurting. That's all. And on the same day, I had another athlete who
Mhm.
dove and she had like a small scrape on her abdomen. And that was like a huge thing for her. And I was called inside and she's like looking at me and like even like a smallest scrape, they'll be like, mom, it's hurting so bad. And I'm like, we have
Oh,
like two
wow.
spectrum of players here. Like, what's happening? But yeah, that do happen. And have to do a little bit of counseling for them. Like, no, no, there's just nothing. You can do it and it's fine. But yeah, it's just a pain tolerance.
It's almost like you never know
Yeah.
what's going to come.
Yeah. And but one season you do with the player, you know who's gonna respond to what injury, how, and you know whom you should push, whom you don't have to push. And then that's like, but yeah, they do act like, but there are very few of them, but they do act that bruise is like somebody has shot them, but you have to just be patient with them. And sometimes you can be like, Arey, kya hai ye? Just move on. That's okay. But otherwise, you have to be a little patient and like, no, it's okay. It's fine. You'll be okay. But yeah,
And
that do
how
happen.
often does someone do this whole Nautanki just to get out of training that day or the game the next day?
So this, to be frank, I've not seen much where they do Nautanki to be out of like to not play because what I've seen, everybody wants to play. That's all they want to do. They just want to play. You make them play anyhow. But to do strength training or conditioning, yes, I've seen such Nautanki. So there's this one fun incident where there was a 1 mile test which was happening, and one of the players, she just started her run, and there were a couple of players who were standing next to me, and she just reached not even half a distance, like one third of a distance or one fourth of the distance, and the players next to me, they're like, "Ma'am, I'm telling you, she's just gonna hold one part of her body and gonna fall down." Within literally 10 seconds, so she just held her hamstring and went down, and she's a bowler. So, and I knew that she's faking it, and I just went to her. I'm like, "Yeah, you're unfit, and it's unfit. It's completely fine. I'll report this to the association." And she's like, "No, ma'am, just give me another day. I'll be all fine, and I can do it." And I said, "For me, the criteria of your clearance is this 1 mile if you want to." And then she was fine the next day and she gave all the tests. And I'm like, how can a hamstring injury just be fine in a day?
Her game backfired.
Yeah, yeah. So, but they sometimes do it for conditioning, maybe, or for testing, maybe. But if you give them, like, yeah, you'll get a chance to play and you have a practice. Yeah, yeah. They're all there. They just want to play. That's all they want to do.
Wonderful. So, when we talk about injury prevention, I know we use so many modalities, right from load management, mobility and flexibility, active rehab, strength training, all of this. So, where would you grade each of these? And like, if you had to say this is the key, what is that?
You being in this profession, there's not one thing to the as a key, right? So it's always multidisciplinary and everything together. But when it comes to strength training and load management are the two things I would consider side by side. Because if we need to be taking care of any weak links, so
Mhm.
hamstring or rotator cuff or whatever it is, if you have not strengthened enough, you are prone to injuries. Coming to load management, if you're overtraining or undertraining, both of them are an issue. So until and unless you take both the things side by side, yes, you will not be able to do injury prevention. You can't prioritize that only this can take care of the other thing. Now, cricket being such a skillful sport, does load management does play a huge role. Coming to flexibility, I would put that after these two,
Mhm.
because if you can take care of your certain restriction and stuff, you are absolutely fine to good to go with certain mobility, certain restriction according to your skill. That's good enough to take care of your injuries. You don't have to sit and do entire body stretch, your neck and everything if it's not needed. So, and you can just do a screening and see which part is tight or which has affected, and just working on that mobility and flexibility would do. But I would consider strength and load management together to take care of injury prevention.
That definitely makes sense. And warm-ups is something that, we can't really emphasize enough. And we've seen a lot of times players tend to cut short their warm-ups or, like just go past it. But how often have you had a situation where you're talking to a player about what they need to do for their rehab? Probably once they go back home, what are some, habits that they need to build, and they just don't do it.
Yeah, that happens if the player has not experienced a pain or a niggle. Those cases I've seen this happens most of the time. But when they start seeing that certain injury or a pain has affected their performance, or they have not been able to practice because of certain niggle, then they do start taking it seriously. But that's sad, right? They have to go through something in order to understand what's the seriousness of it. But when it comes to like senior players, they usually know what they are doing. They would have experienced a lot of things. They know this much of a warm up is good enough for them. And then sometimes they had gone through a niggle, so they would religiously do a program till then I'm there again 100%, and again they'll get back to their cut shot. But these young players, making them understand the importance, and then they go back and they're like, sorry ma'am, we forgot, oh I did not do it. Yeah, that do happen quite a bit, especially in youngsters. I've seen much more than the senior most, or the one who have already experienced all sort of niggles and injuries, so they are much more serious about it. Yeah.
And I mean, I think in a way that's literally what life does to us as well. We don't really value things that we have. It has to go before we start respecting.
Exactly, yeah. Like our parents tell us this is important, don't do this, that's not right. And we are like, excuse me, let us experience it. And then we are like, oh, you were right.
Exactly. And so, one thing that we have done, I mean, as sports science professionals, a lot of times is when we are on field, we substitute things for other stuff. We make do with what's available to help with the rehab. So, what is the weirdest object that you've seen a player use instead of maybe a foam roller or a lacrosse ball or literally anything? Weirdest substitute.
Weirdest. I don't remember that, but I remember once I was just sitting, and I'm
Mhm.
pretty skinny, you know me, right? So I was just sitting and my knees are pretty pokey, and one player just comes and she digs her like here, like on top of my knee, and she just releases it. She's like, now I feel better, and then she goes away. And I'm like, wow, just because you couldn't find a roller, you just use my knee to release it. But yeah, apart from that weirdest, like I've seen them being very innovative. Like they've used a steel bottle or a round bottle to maybe roll a bit. Weirdest, not that I've observed anything else. Do you have you observed anything?
I think what I just heard is weirdest. Your
Isn't it?
knee replacing our lacrosse
I
ball.
know, I know. They just come and like they just like rub it on my knee, and I'm like, what just happened? And then I have this one athlete friend of mine. She's very very close friend of mine. So she does a lot of long distance running. And whenever I go to her house to even chill, and she doesn't want to like bother me or tell me about her niggles or pain. So what she does is like if I'm just sitting cross-legged, she'll put her calf onto my knee or onto my shin or anywhere, and she'll
Oh.
just like roll it on top of it. And she's like, now I feel better. And I'm like, what just happening here?
I think you are built to be a therapist in that case.
Yeah, but yeah, this is
Physiologically, structurally.
yes, but this is coming into my zone, like my close proximity. But that's allowed. She's my very good friend, so she's allowed to do it.
That's true. And one thing talking about very close friends and therapists is I've actually seen a lot of memes about this, about how a person can't afford a psychological therapist. So instead they go to a physio because that's covered under insurance.
Oh, that happens a lot of times. So I think we should be getting much more training in our graduation time or maybe in masters to tackle this, because when you see the sessions are pretty long, they're almost like 30 minutes or maybe 45 minutes to 1 hour. And when you are so long training them, treating them, trying to do pain management, talking about pain psychologically, trying to figure out from where is this pain, why is it so much when it's the smallest thing, and others can come out so easily, and why certain person taking too long. So at that time, it does make a lot of what you are talking to them, how you are counseling them makes a lot of difference. And being into a sport, like, so the state team doesn't have usually have a psychologist, so the players come to you maybe stressed what they would have got from the coach, or maybe from another their peers, or like maybe their parents are putting a lot of pressure on them to perform a certain way, or maybe their external coach is putting some pressure to perform, so they just need to let it out. And that's when they are doing a session, and that's when they feel that they need to be talking to someone. And when you're rehabilitating, you're meeting them every day, one hour, maybe sometime 1.5 hour, and they just constantly connect to you. So yeah, they do end up sharing a lot. And that time, what you say goes in their head like so strong. So you can't be like, "Arey, this is just in your head." You can't tackle it that way. So yeah, it you do come as a physiotherapist and a psychologist at the same time. And but yeah, that happens quite often, and not just like in athletes, even like geriatric population. I think I do 60% of is just talking to them, and there's just 40% of exercise, because in order to make them do, only to convince them takes a lot of time. So yeah, as a therapist, we do become their psychologist as well.
And from there, couple of points is one takeaway is psychological sensitization for all support staff on a team is actually paramount, is what I see from here.
Exactly.
And the other thing is, so see, having worked in multidisciplinary teams, you know that psychologists usually have a supervisor or someone who they fall back on when they are handling situations like this, but we don't. So, I mean, I'm sure there would have been times when you've had players going through a lot and they've let that out onto you when they were on the table. How do you come out of that and how do you handle that?
Okay, to be frank, so far I've been really blessed with really nice support staff, the other support staff whom I've had. And when we were in RCB, we had our own psychologist. So if I wanted to talk to her, we could talk to her. I could come to you, I could go to Subway, I could go to like anyone. And same with Gigi, the support staff which I have so far been with have been really nice. So a lot of time just letting it out what you went through. And but I also need to find a person who will not share this out, or maybe I will just call a random friend back home, and I'll tell her like, okay, this is what happened, and I'm just looking for an outlet, and I just want to let it out, and there's nothing that I am looking and solution to it. There's just a letting it out. Or sometimes I write it about it just to understand, why did I go through this emotion, why did it affect me, because I was not going through that situation, right? They just came and just told me. But when you are in team environment, and when you are like constantly, the matches are going on 3 weeks, 4 weeks, you are together in the same hotel, eating together, breakfast together, lunch together, dinner together, playing together, they're crying to you, they're laughing with you. So it becomes like a family, so you do start becoming a little emotional there. But more, if you start seeing from an third person party, just being an external support, it doesn't affect you so much, is what I understood so far, working with it. More, I start taking it as like, oh, this shouldn't have happened, and more taking it like personally. That's when it starts affecting. So now, more so, I just take it as a third person, listen to it, come up with a solution. If it has a solution, if it doesn't have a solution, just listen to it, and that does a lot of wonder. And if there's it just goes overburdened, then I just go to a person to like talk about it or write it about it, and then that's all. Yeah, that helps me quite a bit. But as you were mentioning, that all the people in the team should be sensitized in case we don't have a psychologist. That's a really, really important point. I've seen a lot of players going to the SNCs because they'll be like they would have worked with them for a longer time, and they're discussing with them. So not that I'm expecting you to be guiding them or psychologically giving them a therapy, but to identify that now your athlete needs a psychologist, you to be able to guide them in a right direction. If they're listening to you, then you should be able to tell them, hey, it's, I think, high time, it's affecting your performance. Or even a layman, like, it's affecting you now, this thing has taken too much of a toll, I think you should meet a professional. So there is a certain extent you can help them, but you can't take the job of a psychologist for sure.
Of
So
course.
yeah. So it's very important to you to be able to tackle or be able to give them comfort at that moment if you are in a tournament and if you don't have a outsource. But if I'm treating somebody in my clinic and at that point I see somebody needs it much more than what I can give, then of course I will tell them, listen, it's time for you, and I think we need so and so person, and you can consult them and meet them, and then yeah, guide them in the right direction basically.
Because in a lot of places we have seen how psychological disturbance causes somatic pain,
Yes.
so
Yes. Yeah, it
I think that
stores
really
and
has weightage. Yes.
yeah, that trauma
So
stores, they are constantly in pain. Some of the other pain creeps in because of that. So if they've not tackled that, how much ever you treat them physically, they're just not out of it.
exactly,
Yeah.
exactly. So moving to something a little more light, pole.
Okay. Oh,
So how did that journey start for you? How did you start twirling?
okay. God. So the poll, okay, I was just basically looking for anything because as I have already mentioned about me being skinny, so the my main focus was to look at something where I can build a little bit of a muscle and strength. That's all I was looking at. I went for one bouldering classes, which was very good. Bouldering was very good. We went outdoors, but it gave lot of bruises on the finger, which made my occupation too difficult. And I'm like, okay, I need to find something else that I can, my fingers are safe, was the only thing. And at the same time, similar time, one of my client, she started doing pole, and I have I had a lot of dizziness issues. So my only thing to her was, because I have motion sickness, I'm like, do you get really dizzy and do you get pukey? And she's like, no, no, it's all fun. You should just try once. I just tried it, I think last year, before our WPL. Yeah, I went for my one class, and then I'm like, and I got wow by the women. So women of all shape, men of all shape, whoever were there, they look
Wow.
so beautiful and elegant on pole. So more than strength, it became body positivity for me. And I saw like women who are bulkier are also doing it so beautifully. And it requires a lot of strength. You're curling, you're crunching, a lot of hamstring grip, you're pulling your body, a lot of arm strength, a lot of core strength. And I'm like, it's such an empowering body, empowering dance form. It's so beautiful. And that's how I got hooked up to it. And after WPL, I got back and I got very seriously got into it every week, once a week. I used to go and I started to see in 4 weeks the kind of stuff I could do with it. And it actually helped me not just to look better on a pole or get my poses, but it also helped me, like, I couldn't do pull up earlier. And I could start doing pull up because of that, because it helped me to build. And I was enjoying the dance form. So I could put little bit more time into my strength training because I could see some result. Before I was doing strength training, but where will I use it? I was not physically like utilizing it anywhere. So now when I started doing pole and then strength training, and then that journey, just like pole has become like a part of me. Like, even if I travel and even if I did get one day of in Bangalore, I'm like, okay, can I go to my teacher? She's so amazing. Can I learn something new now and come back? So my happy hormones are always like, yay, and dancing whenever I go for pole. So I just can't let go of it at the moment. But it started to just build a strength. And now it has become an enjoyment point. And more than that, what I also saw, the entire pole community is so beautiful. Like, like we are like 6 7 women performing, like practicing it, and like one of them would have got the move, all the six have stopped and they are footing, they're clapping, and they're just enjoying even a simplest move if you would have got. And what is better than getting appreciation? Like, everybody's appreciating for everything, right? So and our entire small Bangalore pole community is so beautiful. Like, if you talk to anyone, everybody will just talk about this. Only the
That's
one who is a part of it will understand.
No, it's actually so beautiful. I'm getting FOMO, and I love the fact that you said that size does not matter for pole, which is actually a misconception. I think a lot of us feel like, you've got to be super skinny to be able to do pole. and all that body positivity around it is sounding just amazing.
Yeah.
And core strength, I mean, you need that, right? So,
Yeah.
and you were talking a little earlier, we were talking about how you wanted to become a pole instructor yourself.
So instructor, I would still say it's too far. Okay. What I was looking at is to be able to assist as a physiotherapist in pole is what I
Okay.
am looking at. So how we were discussing about injury prevention and flexibility and strength training, etc. But when it comes to, so each sport has their own requirements. So if you look at like gymnastic and pole, like they require a lot of like flexibility, length of a muscle, yes, but it also requires a lot of eccentric control of that muscle. So if you have just trained the person in order to get the length and never train the eccentric, that's when they start getting much more, like a lot more injuries. Like I've seen so much of piriformis injury, now sciatic. I had one incident where a girl was on a pole and her back got locked and she couldn't move after that. So injuries are much more prone if you are not training according to the sport. So what I want to do is get much more. So right now I'm in somewhere not in a pro level. I've just like crossed my beginner level. So there's a lot more to it which I also want to explore. But I would like to give something to this community to be able to help the ladies better so that they can pursue this a lot for a little longer time and they don't have to give up because of some injury. So that's as all I am looking at being a physiotherapist and who's also practicing pole to be able to give to the community a little better. There are a lot of really good chiropractor outside whom I've gotten in touch to understand how all this work and what are the other kind of moves and like what is further into it, because there's a lot more I have to explore. So yeah, I've been in touch with people to understand. So that's where I want to like bridge in the gap.
That's actually beautiful. And I mean, it is an aesthetic sport. We consider dance to be an aesthetic sport. So if pole is literally dance, and there is
Yeah.
no reason why there shouldn't be sports science support for.
Yeah. So we had this an example where there's a lady who was experiencing a nerve pain and her nerve pain settled and the SNC she was going to, he was just sticking to like a normal deadlift, and deadlift she can do. She's a strong girl and the range of your hamstring and stuff needing in deadlift, she was all absolutely fine, but the range which we need for our pole is much deeper than that. So if you don't even train her in that deep range of her strength, she will not be able to perform and execute it there. So that understanding, first of all, to show people what exactly we need and what are the strength we are requiring for this, and is itself a lot of SNCs are not aware of. That's because it's just a different dance form. People just have to get used to it. They need to understand what is required for it and then train according to it. So yeah, so of course the sports science need to under, like in India there's still a lack. First of all, to look at this sport, to look at pole dancing itself, people look down upon it, and I don't understand why that should happen. So until unless people accept that, they will then will come another physio support or an SNC would start putting their mind into what is needed for this,
Yeah,
right?
I think there's a lot of taboos that we need to get over as a country. Yes. And another funny question. Have you ever had a player who either kept talking so much or complaining so much that you just wish that the tape was on their mouth instead of whatever body part?
So far, I have not got
Can be
upset
support staff also.
with. Okay, so far I've not got upset with the player for cribbing about pain. So far,
Okay.
okay, I am not aware of the future. They have increased my patience level a lot. The players have increased my patience level a lot. But support staff, yes. Yeah, a lot of time. That happens a lot of time. Like of smallest of basic, like listen, the player is like almost like fainted. The player is dying, and here you're talking about like, हाँ खाना अच्छा नहीं है, and I'm like, excuse me, what am I supposed to do about it? Let me just go handle that, and I'm like, you shut up, let me focus on my work. But players not yet. I think I really like my kids around, and I really like to listen to them, and I'm like, yeah, how can I help you better in whatever way it is, even if I have to like mummy you a bit and like be your elder sister, but yeah, not with the players. not at all. But staff, yeah, like specifically the management part, like the management side of it. If they start and then I'm like, you know what I'm talking about?
Yeah, I'm taking a very personal attack here.
You know it's not you, but
Yeah,
okay.
I know. Yeah. And one thing that a lot of physios were just budding, and I know a lot of people who've actually been physios in the clinic environment for a long time who want to get into team on field sport. What does it take and what is the journey like to becoming the head physio of a WPL team?
Okay, so I would, if somebody asked me after graduation, like, how do you get into the team? I would definitely say do some clinical work. The amount of exposure and understanding you get by doing a clinical work and the number of condition you see, you are a much better physio to tackle that. So now, when you are on the ground, now you've just come out fresh and you see something on the ground, and you have to be a little bit more creative sometimes. For example, I'll give a very simple jugaad example. So there was one of the player, we did not had a my first day of Karnataka state, and she has undergone a surgery for her finger, and she has to get back to fielding. And she's a very important player. The coach captain has told me this player is needed. Do something. She has to perform right now. It's my first day, and I don't have any finger cap, no fancy stuff we have. But I used double tape, used a dyno, made a finger cap out of double tape, made her play, and I could use that because I have some exposure, some understanding about it, what is needed. If I would have just come as a fresher, I wouldn't have even known what to do about it, right? So I would definitely suggest do some clinical work, get a clinic which has some sports athletes. If your aim is to get into sports team, then you get into any of the state level or any other level so that you get much more of an idea. And then wherever the opening is, please give the interview, go feel free and just give the interview. And then things might work out. But I think for us, the turning point for me also was a turning point to be a part of RCB and RCB winning a trophy as well, right? Of course, yeah, players do better. Our name also like gets better, and it's all hand in hand. Of course, we have done a job in the behind the doors, but what how they perform on stage also takes us also ahead. So but if you are doing your work regardless of thinking whom you're treating, what you're doing, treat everyone, anybody comes your way, do people will recognize you, they will see you. Don't have to think about, oh, this is a better player or this player is doing better, I would treat only that. You will not go anywhere. Just do your job with the loyalty, and things will work out. That's all I can say about it.
That's beautiful. So one last question before we sign off. If you had to give a one-liner advice to anybody coming, I mean, I know you just gave an elaborate one, but a one-liner advice to anybody looking to get into sports science or teamwork, what is that?
Respect everybody's opinion in a team. You will never know who will come with the most valuable input, which will change everything. And in my journey, I have met so many physios who would have told me about some injury sometime which I wouldn't have seen. And when I am treating, I would have come across that. And his words and thoughts would have helped me now, which would be must be a year later or 2 years later, or maybe within like 24 hours or within 2, 3 days. So always respect everybody's opinion. Even if you feel that that person doesn't know anything, actually, that doesn't exist. Everybody knows a lot, and it's just like there can be way like understanding difference in understanding that can happen, but yeah, respect it to everyone and listen to everyone. Of course, do what you want to do, that's okay, but do listen with an open mind, and yeah, that can take you ahead.
That was beautiful. And I think we had a very fun interaction and touched on a lot of very important areas. So thank you so much again, Ridu, for taking the time out to come on our podcast. It was a pleasure having you.
Thanks for having me, Harini.